Great. Well, first of all, thank you all for being here today. I had the chance to tour the North Central Healthcare Facility here and see some of the great work that facility is doing, and all the work that they're doing both around the community, particularly with their mobile teams, which are able to help intervene early in the process and try to reduce the number of people who end up having to get inpatient care. And then I had a chance to talk with some law enforcement leaders, as well as folks at the hospital here, about the work that they're doing collaboratively to work both to address cases involving emergency detentions with people who are facing healthcare emergencies, mental health emergencies, and also the work they're doing collaboratively to work to address the opioid crisis and the growing meth problem that we face in Wisconsin. It was really encouraging to see there's some innovative programs going on here in Marathon County that are helping to make sure that we're looking at things holistically as a system. These are issues where there's a lot more work to be done at a state level to address emergency detention, and also to work to address the opioid epidemic and the growing meth problem. So with that, I'm happy to take questions from anybody.
On the opioid front, Wisconsin has joined other states in suing companies themselves. Is that a good approach, and does it make you nervous that you know how tough big corporations are to not necessarily bring down, but to go after? Is that just a piece of the overall puzzle, would you say?
I think it is one of the pieces of the puzzle. I think there are three things we really need to be doing to fight the opioid epidemic and the growing meth problem in Wisconsin. And I guess, first of all, let me just say, this epidemic has been devastating for families around the state. There were over 900 opioid-related overdose deaths in Wisconsin in 2017. The number of kids who've been separated from a parent due to a drug addiction has increased significantly. So this is a problem that I view as the most significant public safety issue we face and one of the most significant public health issues. At first, I think we need to make sure that we are working to prevent people from becoming addicted. That includes raising awareness about the dangers of opioids and about meth. Also, I think people need to make sure to dispose of their unused and unwanted prescription drugs. So number one is prevention. Number two is we need to expand access to substance abuse treatment so that people who are suffering from substance use disorder are able to get the help that they need to get back on their feet. But third, I think accountability needs to be part of the response to this epidemic. I think that's important both so that we have an accounting of what led to the epidemic so we can respond to it most effectively and also hopefully prevent a future epidemic. But it's also important because where there have been companies that have made profits through false or deceptive marketing practices, holding them accountable and getting those resources for communities in Wisconsin is critically important so that we can fund treatment and prevention and education efforts. We are in Wisconsin, we filed suit against 2 Purdue Pharma entities, as well as Richard Sackler, a former co-president and co-chair of the board of Purdue Pharma Inc. We're also part of multi-state investigations into manufacturers and distributors of opioids, and we are very serious about holding companies that engaged in false and deceptive marketing practices accountable for those practices.
You've referred a couple times to the growing meth crisis, and that's what it looks to me like that's growing quickly. Why, and what can Wisconsin do to head off that growth, I guess?
There's been, as you said, an increase in meth distribution in the last few years, particularly in the north and western part of the state of Wisconsin, but it's a problem that is affecting communities across the state. It looks like a lot of this meth is coming in through Minnesota, and one of the things we need to do is first work to prevent those drugs from coming to Wisconsin, and partly that means ensuring that our enforcement efforts are targeting large-scale traffickers of meth as well as opioids, so that we can prosecute people who are illegally distributing meth. Again, though, we need to expand access to substance abuse treatment so that people who are addicted are able to get the help that they need. Unfortunately, I think there's a myth out there that, given how dangerous opioids are, that people who are addicted maybe should switch to meth. This is also an incredibly dangerous drug, and we need to make sure that people are aware of the dangers of becoming addicted to meth.
Is there a little bit of a whack-a-mole quality? I mean, there's been so much emphasis on opioids, and now we have a growing meth problem.
I think these are both significant issues, and we need to make sure that we're addressing both of them. When you enforce the laws that relate to one particular narcotic, it's true that other dangerous ones can pop up. But we need to make sure that our enforcement efforts are targeting the most serious and most dangerous drugs. And to me, that includes meth, it includes opioids. Another problem we've seen is an increase in the distribution of fentanyl, which is an incredibly dangerous narcotic. So we need to make sure that's where our efforts are focused, both at meth and at opioids. And even though there may be distribution of other drugs in the future, we've got to make sure that we're focused on the problem at hand right now, and that includes meth and opioids.
What level of the responsibility falls on individuals? Some people will say, well, if you don't want meth to be a problem, don't do meth. Don't get addicted to opioid. I mean, is there a level of personal responsibility that individuals need to take?
Well, I do think that we need to make sure that people are aware of the dangers of using opioids, and certainly as well the danger of using meth, because if people do use those drugs, they can become addicted. It's a real danger. But it's also not as simple as just saying people shouldn't use. They certainly should not. But one of the things we've alleged in our complaint against the Purdue Pharma entities and Richard Sackler is that there was a concerted effort to mislead the public and prescribers about the dangers of opioids, to overstate the benefits of opioids and to downplay the harms that they cause. So part of it is also making sure that accurate information is being provided to the public, so that people know that even if they're taking something that's prescribed by a doctor, they can still become addicted, and they need to make sure that they're using the medication appropriately.
All right. Anybody else?
Regarding the state Supreme Court decision last week on those the lame duck bills, so to speak, what does that mean for Wisconsin's, specifically the involvement in the Affordable Care Act lawsuit? Does that change the action that you took to remove the state at all?
It will not have an effect on that lawsuit. The state withdrew when the injunction was in effect, and the state Supreme Court's order made it clear that the state Supreme Court was not asking for those actions to be undone. So the state of Wisconsin is no longer part of the lawsuit that's seeking to invalidate the Affordable Care Act. And I'll add, that's a really good thing, because if that suit is successful, millions of Americans will lose access to affordable health insurance coverage. Protections for people with a pre-existing condition would be eliminated, and young adults would lose the guarantee that they can remain on their parents' coverage until they turn 26. So Wisconsin is not part of that suit. It is not going to be part of that suit, and that's a good thing for Wisconsinites.
So there's nothing that could be done to reverse that action at all, correct?
We will not be seeking to rejoin that action. That's right.
And do you have any other comment then on those decisions that were rendered last week at all?
Well, the case is ongoing. The order that came out recently was a stay of a preliminary injunction. So there are more proceedings that will take place in that case. I think the legislation that we are challenging that relates to the AG's authority clearly violates the separation of powers, gives authority that belongs in the executive branch to the legislature, and I think that the current legislation we have has led to a lot of litigation, as we've seen, and it has distracted us from the important work we need to be doing, which is making progress for Wisconsinites. So I'm hopeful that we'll have a resolution of this relatively soon, and that we can move forward under a governing structure that's consistent with our separation of powers.
And then just one more, if I may, regarding the way these laws came about in the extraordinary session. The court said that the legislature does have the ability to call itself into session whenever they like. I mean, is that something that you'd like to see changed, or do you feel that law is not being interpreted correctly? Well,
the Supreme Court ruled on that issue, and so that issue's been resolved now by the courts, and the court has decided that the legislature can meet an extraordinary session under the terms that it has. Certainly, if that's something the legislature wants to revisit, it can set different rules for that process. But what remains in this case, and what I think the core issues really are the separation of powers issues. Whether the legislature has the ability to control the way that litigation is resolved in the state, or if, as is true in every other state in the country, that is an executive branch function. I believe it is an executive branch function, and we'll see what the court decides as the case moves forward.
All right. Thanks,
so
guys.
I have one more question.
Go ahead.
I have a question aside from this. So what are your thoughts on Illinois legalizing marijuana? Do you think it'll make its way to Wisconsin? And do you think if it does get legalized here, will it help with the opioid epidemic?
So I think what Wisconsin should do is move forward with the legalization of medical marijuana, and I think we should then assess to see how that goes. And I think there are a few different reasons we should do that. One is, I think there are people who face serious pain issues who would benefit from being able to have access to medical marijuana. I would also rather see somebody who could be prescribed either medical marijuana or an opioid. I would rather see them get a prescription for medical marijuana, given the problems we've had with the opioid epidemic. And this is also a potentially significant source of revenue for the state. I think we could use the money that we raise as a state from the sale of medical marijuana to help address some of these problems like the opioid epidemic and meth addiction. So for those reasons, I'd like to see us move forward with medical marijuana.
All right, and then just kind of broadly speaking, why is it so important for you to implement some more of these substance abuse programs? Do you think over time, how long do you think it'll actually take to help?
I think this is a problem that's going to go on for a while, and we need to keep working to make progress. There have been some encouraging signs. The volume of opioids prescribed has decreased in the last few years. I hope that trend continues. But there are people who have addictions to opioids, to meth, and to other drugs, and we need to make sure that we are doing what we can to get those people substance abuse treatment so that there aren't the worst possible consequences that result, and instead people are able to beat their addictions and to get back on their feet.
All right. Thanks, guys.
Thanks.